You know, so many of our pets that may have arthritis, whether it's a cat or a dog, reluctant to accept grooming. How do we handle that? What are some recommendations for these cats that are matted or these dogs that could be matted? Y'all have any tips there?
So there's kind of big crisis level and then there's daily maintenance level, right? So we want to start encouraging gentle grooming, finding out what the cat or dog, but often this is cats who can't turn around and get that area right above the base of their tail. So working with them on accepting grooming of light grooming that can be done daily, which I think can also be bonding for the owner and the cat for the most part. I say that with a grin because my particular cat doesn't actually enjoy being groomed, no matter what kind of food she's eating. So, not always. But when we have a need to really get rid of mats and shave them down, which I think is really important because they're uncomfortable, right? That contributes to stress and discomfort because the mat can pull on the skin and is uncomfortable. And I think cats don't like to look that way, right? They spend a lot of time, like a good percentage of their time grooming. And I think it's important to them. So sedation, I think, is important for that. And Dr. Bartling and I were talking before this seminar about using pre-visit pharmaceuticals to assist with that too. So to get cats and dogs into the clinic in order to be able to then sedate them and get them really groomed down. So using in cats, gabapentin is probably the most commonly used. Trazodone is occasionally used. Lorazepam is increasingly used in healthy cats. So using something to get them into the hospital. And one of the things that we'll always recommend is that people try them at home, in particular for trazodone. But really, when we see a percentage of patients who have an idiosyncratic excitatory reaction to a medication, we want to know that before we're trying to then put them in the car to bring them in. So, talking with owners about how generally safe these medications are, how incredibly well tolerated they are, um, but giving them the kind of opportunity to try it out at home before bringing them in, and knowing that even if they did have one of these excitatory reactions, it doesn't last that long. It just means we don't want to then stress them out by putting them in the car. But I do think it's important to do and to make the visit as stress-free as possible and to go ahead and use sedation in order to really get it done.
Yeah, I might add to that, if you really think they're painful for any specific event, I add additional pain medication. So yes, sedation and anti-anxiety medication, but I might make sure they got, if they needed their Rimadyl that day, etc. And for veterinarians out there in the clinic, we'll be talking about some of the less traditional kind of pain medications, but sometimes we'll even use a low dose of ketamine and methadone because it will make them very sleepy for a very short amount of time and also remove some of their pain.